The minute it gets warm, I convince myself I need a whole new wardrobe and then end up with a pile of clothes I never really actually wear. But this year, I'm shopping Quince. They have so many things for summer, and since I basically live in skirts and dresses as soon as the temp gets above 80 degrees, I am in love with their 100% organic cotton poplin tiered maxi skirt. It comes in beautiful colors and looks so breezy and lightweight. I know I'll be living in it all summer long, whether I'm out wine tasting, which is one of my most favorite things to do, or just heading to the farmer's market, or even just running errands or hanging out with friends or my husband. It's the perfect item to just throw on that still makes you look put together. And since everything with Quince is priced 50 to 80% less than what you'd find at similar brands, I can treat myself to two of these skirts with zero guilt. Treat your closet to a little summer glow up with Quince. Go to quince.com/nursemo for free shipping on your order and 365-day returns. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Well, hello. I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips on how to thrive in nursing school and at the bedside. Today's shout out goes out to Sandra, who wrote in to say, I used the LATTE method to study for my last exam in Surg 2. Best grade this semester. Thanks, Nurse Mo. Well, Sandra, thank you for letting me know that the LATTE method helped you so much that you got your very best grade on your final exam in Surg 2. That's a tough class, and I am really, really proud of you. So if you're wondering what Sandra is talking about, the LATTE method is a streamlined and focused approach so that you really just zone in on the key things that you need to know. And we're going to be utilizing the LATTE method in today's episode. So let's hop right into it with an episode about postpartum hemorrhage. This is a potentially life-threatening complication that requires very swift recognition and intervention. It's actually, I was surprised to see this. I was reading about this condition. It is actually one of the top 5 causes of maternal mortality, which knowing that makes timely recognition and prompt treatment even more critical. So whether you're a student studying for an exam or gearing up for your labor and delivery clinical, this is a definite must-know topic. So we're going to break it down using the LATTE method, like I mentioned just a moment ago. But before we do that, let's lay a little bit of a foundation with some some risk factors, and potential complications. You ready? Okay, let's do this. So in normal physiology, there is a coagulation cascade that you learned about in anatomy and physiology that helps regulate blood loss after birth, as well as uterine contractions, which help regulate blood loss after birth. And when either one or both of these mechanisms are disrupted, then blood loss can be significant. And if it is not treated, can lead to very severe complications, including maternal death. So we definitely don't want that. So what would we consider postpartum hemorrhage? Like how much blood loss is considered postpartum hemorrhage? Now, I saw a few different ways this is defined, and it was based on the organization that was defining it. So the World Health Organization, for example, says it's a blood loss greater than 500 mils within 24 hours after the birth. The American College of Obstetricians and Gynecologists define it as a cumulative blood loss greater than 1,000 mils accompanied by signs and symptoms of hypovolemia within 24 hours of giving birth. And then the California Maternal Quality Care Collaborative defines it as a blood loss greater than 500 mils after vaginal delivery or greater than 1,000 mils following cesarean delivery, and vital signs indicating hypovolemia, which for your review are things like tachycardia, hypotension, and lower SpO2 sats. So just know that you could see any of those on an exam What I did see as I was reading about it was that the American College of Obstetricians and Gynecologists one might be the most recent, but there was also a caveat that said anything over 500 mils is cause for concern, which makes me think, well, why not just go by the California Maternal Quality Care Collaborative, which was blood loss greater than 500 mils following vaginal delivery or 1,000 mils following cesarean delivery, which is actually what my sister-in-law says that they use at the facility where she works. Okay, so just so you know, could see a few different things, but that's the general guideline. So why does postpartum hemorrhage happen? So the main causes of postpartum hemorrhage can be summed up with the 4 T's. This is tone, tissue, trauma, and thrombin. So I'll talk about what each of these mean. So tone refers to the tone of the uterus, and the most common cause of postpartum hemorrhage is uterine atony. And this is when the uterus does not contract effectively after delivery, which prevents that mechanical hemostasis from occurring. When the uterus contracts, it clamps down on the blood vessels, causing basically mechanical hemostasis. When the uterus is soft or boggy or not able to contract, then we're not going to get that and we're going to have bleeding. Risk factors for atony include prior postpartum hemorrhage, prolonged labor, multiple gestation, so having twins or triplets or what have you, induced labor, presence of uterine fibroids, polyhydramnios, which basically makes the uterus kind of bigger than expected, and magnesium sulfate therapy, which is used for preeclampsia. Now, there are others. These were some common ones that I saw as I was doing my research for this podcast episode. So that was tone. Another is tissue, and this refers to retained placental fragments, placental tissue that prevents the uterus from contracting fully. So risk factors for this include placental disorders is the main one. That's going to be things like placenta accreta syndrome or PAS, which is a condition in which the placenta adheres abnormally to the uterine wall. It could be placenta previa, placental abruption, retained placenta, and low-lying placenta. So think of uterine or placental abnormalities that are going to prevent the uterus from contracting adequately. So we talked about tone, we just talked about tissue. Next is trauma. So this could be lacerations, surgical incisions, uterine rupture, or hematomas. These can all cause postpartum hemorrhage. Now, risk factors for trauma-related causes include use of instruments for an assisted vaginal birth, a persistent occiput posterior position of the little baby, and a midline episiotomy. I'm sure there are others. These were just some of the key ones that I found. And then the final one is thrombin, and this refers to coagulopathies. So coagulopathies prevent adequate blood clotting. So in addition to patients who have pre-existing clotting conditions like von Willebrand disease, other risk factors for coagulopathy include placental abruption, preeclampsia, HELLP syndrome, HELLP, fetal demise, sepsis, and amniotic fluid embolism. Now, I do have a couple other episodes you might want to listen to. I do cover HELLP, HELLP, in episode 79. I talk about placenta problems in episode 92. And in episode 252, I dive into amniotic fluid embolism. So I'll put a link to these in the episode notes if you want to go check them out. Definitely very interesting subject matter. I learned a lot while I was researching all these topics, so I'd love for you to give them a listen to. So just to recap, those 4 T's, which are the main causes of postpartum hemorrhage, are tone, tissue, trauma, and thrombin. So now that we've got a little bit of foundation knowledge about postpartum hemorrhage, let's move into the key things you need to know using the straight A nursing LATTE method. Are you ready? Let's get to it. So the first letter is an L, and that stands for look. How does the patient look? So this would be the key signs and symptoms. So one of those is increased lochia. You're looking at blood, bright red bleeding that saturates a peripad more than expected. Like anytime a peripad gets saturated, completely saturated in less than an hour, we're very, very concerned. And we'll talk about quantifying blood loss in just a moment. So one of those signs and symptoms, bleeding or increased lochia, large blood clots, a boggy and soft uterus upon palpation, tachycardia and hypotension. Note that these could be late signs, so hopefully you're not waiting for vital signs to tell you that your patient is bleeding. The patient may have pallor, feel dizzy or faint, and they could have anxiety or restlessness, which could be early signs of hypoperfusion. The next letter in the LATTE method is an A, and that stands for assess. So how are we going to assess this patient? Your key nursing assessments for a patient with suspected or active postpartum hemorrhage are first off to assess uterine tone and position. So a normal assessment should reveal a uterus that is nice and firm and in the proper position relative to how much time has lapsed since delivery. So let's first talk about uterine tone. To assess this, we're going to position the patient supine or like a semi-Fowler's, low semi-Fowler's position with the knees flexed. You stabilize the uterus with one hand and cup the other hand over the fundus and press firmly. Now that fundus should feel firm. If it does not, this indicates uterine atony and places the patient at high risk for postpartum hemorrhage. We'll talk about what you're going to do about it in just a moment. Now, about fundal position or uterine position, you're looking at the location of the fundus in relation to the umbilicus. So about an hour after delivery, the fundus should be midline and at the level of the umbilicus. So that's a key assessment, uterine tone or fundal tone and position. Next is the amount of bleeding. Blood that can actually be collected and measured in a graduated cylinder really is going to provide the most accurate way to quantify blood loss. However, many times the blood has saturated a peri-pad or the bedding. So you could see someone estimate blood loss by visually looking at it. That's an EBL, estimated blood loss. It is much more accurate to get a QBL or quantitative blood loss. This is going to be much more accurate. So how do we do that when we've got saturated items? Well, we weigh them. We weigh those items and we know what they weighed dry. We compare that to how much they weigh wet, and that volume that they are in wet represents how much blood is on the item. Of course, you subtract out the dry weight and we convert that to volume. So for example, if you had some bedding that was 1 kilogram heavier at its wet weight, you would know it had 1 kilogram of blood, which would equal 1 liter or 1,000 mils of blood loss, which would be substantial. You're also assessing level of consciousness and neurological changes. Blood loss and its consequences can cause agitation, restlessness, confusion, dizziness, faintness, and lethargy. Any change in the patient's neurostatus or level of consciousness should be cause for concern and warrant further investigation. You're also keeping a very close eye on vital signs with frequent monitoring. Every 5 to 15 minutes is pretty common in a patient who is suspected or confirmed bleeding, maybe even more frequently if there is a lot of blood loss going on. Skin signs can definitely be altered with blood loss. It can cause the patient to have pallor or clammy skin, so keeping an eye on that. You also want to watch urine output. Decreased urine output is a sign of what? It's a sign of poor tissue perfusion, which is a consequence of hypovolemia secondary to blood loss. And then the patient's emotional state. Let's not forget this. The patient is likely to be frightened or confused, really anxious about all the things that are going on. All right, so now let's move on to the first T in the LATTE method, which stands for tests. And tests are going to be mostly labs. So labs you may see ordered include a CBC. We're going to get an idea of what their blood loss is. We will want a coagulation panel and a type and cross match in case blood products are needed. Now you could see an ultrasound ordered that could be utilized to check for retained tissue and visualize the uterus. Mostly though, it's going to be labs in most cases. Let's take a quick break, and when we come back, we'll talk about treatments and education, the final two components of the LATTE method.
The spirit of innovation is deeply ingrained in America. And Google is helping Americans innovate in ways both big and small. Central Texas Regional Mobility Authority is using Google AI to create smarter tolling systems and improve traffic flow for Texans. This is a new era of American innovation. Find out more at g.co/American Innovation.
So next we have a letter T, and that is for treatments. What are we going to do about it? How are we going to help this patient? So the key treatments for postpartum hemorrhage are aimed at addressing the underlying cause to avoid further blood loss, and then also maybe replacing blood as needed. So let's talk about some of these key treatments. First is fundal massage. Massaging the fundus or massaging the uterus helps it to contract, which provides that mechanical hemostasis to reduce bleeding. Now, to perform this intervention, you place one hand above and one hand below the fundus in that cup formation and massage until tone is restored. Note that fundal massage is not done on a firm uterus, only that soft or boggy uterus. And then we have medications. Uterotonic medications like oxytocin and misoprostol can help the uterus contract. There's also intrauterine devices. So a balloon device may be utilized to tamponade bleeding, basically press on the vessel so that it doesn't bleed. That's called tamponading. While a low-level vacuum device encourages the uterus to contract. So these are two different types of devices. They have different brand names. One is a balloon and one is a low-level vacuum. You also may utilize volume replacement in your patient. Some patients may need this to maintain adequate cardiac output. This could be IV fluids, blood products, or a combination of both. We also want to correct any coagulopathies if they exist. We could give blood products or clotting factors to do this, and there are clotting factors in blood products, so that's why you'll see either one of these utilized. Those blood products would be things like fresh frozen plasma or FFP or cryoprecipitate. And then in some cases, surgery will be warranted. When we can't control bleeding by these other less invasive measures, the patient may need surgery. This could include uterine artery embolization to stop bleeding, repair of lacerations, removal of retained tissue, and in some cases, the patient may even have to get a hysterectomy. So those are the key treatments: fundal massage, medications, intrauterine devices, volume replacement, correcting coagulopathy, and surgery. And then the final letter in the LATTE method is an E. How do we educate our patient about postpartum hemorrhage? So even in an emergency, education is key. What's important to know is that even though you're educating the patient during the crisis, because you do want to explain things as they're happening so that you can lessen their anxiety, lessen their fear, ensure them that everything is being done that needs to be done, they're not actually in active learning mode. Education in the moment like that is used to reassure the patient. We want to make sure that the patient is actually receptive to teaching when we come in to do our, like our discharge teaching, for example. So things that we're going to cover with our patient with our discharge teaching after they've had a postpartum hemorrhage are that bleeding should lessen over the next several weeks. So they do need to keep an eye on it, though. We want them to keep an eye on signs of increased bleeding, a delayed or secondary hemorrhage. So signs of this could be heavy bleeding that saturates that peripad within an hour, clots that are larger than an egg size, feeling faint, feeling dizzy, feeling their heart racing, any of those signs that they could be hypovolemic. You want to encourage rest and gradual return to prior activity levels. And if the patient has been prescribed iron supplementation, teach them that it can cause dark stools and that liquid formulations should be taken with a straw to avoid discoloration of the teeth. And another common side effect that I almost forgot to mention that is very common with iron supplementation is constipation. So you want them to know that they could expect that and some strategies to mitigate that, such as a stool softener, increasing fluids, things like that. And you also want them to know when to call their doctor. This would be new signs of bleeding, being unusually fatigued, a fast heart rate, worsening abdominal pain, anything that causes them concern and makes them think they could be bleeding again. So if this episode helped you feel more confident about recognizing and reacting to postpartum hemorrhage, and I just covered the basics here, it's actually quite in depth. My sister-in-law sent me a whole protocol and I got palpitations just looking at it. The thought of caring for a patient in a critical situation like this is really scary. So I'm glad that smart people like her are on the case. She's a labor and delivery nurse. But this episode covered the key things that you would need to know as a student, or maybe just the general overview going into that OB clinical or starting out in a labor and delivery unit. I do have a lot more maternal newborn content that I'd love to share with you. I will put a link to that in the episode notes, or you can just go to the straightanursingstudent.com website and use that top menu bar to easily find episodes of interest. I hope you come back and join me again with another listen of one of my episodes. Just make sure you're subscribing so you don't miss anything, and I will be in your car stereo, earbuds, what have you, again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Hey y'all, life's journey is filled with change, growth, and exciting new chapters. Whether you're welcoming a new family member, stepping into a new city, or chasing after your biggest dreams, you need a ride that's built with more space for the grand challenges ahead. The Toyota Grand Highlander is made for those who embrace every twist and turn. With advanced safety features, innovative tech, and a bold, sophisticated design, it's the SUV that adapts with you with room to spare. This spacious beauty seats up to 8, gives you up to 97.5 cubic feet of cargo space, and has a diverse engine lineup, available in gas or hybrid options, including the powerful 362 horsepower Hybrid Max. Plus, available all-wheel drive means you'll have confidence no matter where life takes you. Ready to take on your dreams? The Grand Highlander is more than a vehicle. It's your partner in embracing all life throws at you. From daily routines to unexpected adventures, it's up for every grand challenge. Learn more at toyota.com/Grand Highlander. Toyota, let's go places.